Hi guys. So I wanted to jump on here and just show you some of the latest things I've been studying and researching. Back in November, I was super excited because Sir David Davis stood up in Parliament and proclaimed that vitamin D could halve the poor outcomes of COVID-19 patients by just taking a simple vitamin. Amazing. So the government said they were going to look into this and publish a report on it. Now, I was very saddened to see what was published today, because if you look at the headline, it clearly proclaims COVID-19. There's not enough evidence to say taking vitamin D prevents coronavirus, which is sad. And this piece of work was done by the National Institute for Healthcare and Excellence. But let's actually look into the report, because these articles on Sky News or BBC, they have very little detail. The days of investigative journalism seem to be over, and they just publish the press release. So I looked into the study, and what they were analysing was the Castillo study in Spain. And what happened here was a doctor in Spain had set up a randomised controlled trial to find out what happened when they gave half of their patients vitamin D in high doses. And what was amazing was 98% of people who were given vitamin D didn't end up in ICU, which is incredible. I mean, that's so effective. And in the control group, half of people ended up in ICU, half didn't. So it was pretty much a random chance. So then why are they concluding that vitamin D does nothing? Well, one of the reasons is they think the doctors may have known who had the vitamin D and who didn't, and manipulated who went into ICU and who didn't, breaking their Democratic oath, which I don't know any doctors who would do that personally, especially when it was actually a committee of them as well. And then later in the report by the NICE Institute, you see they use this study, a large retrospective observational study of over 340,000 people, and they found that there was no link between serum vitamin D levels and the susceptibility to COVID-19. Well, firstly, that's a different thing. Susceptibility to a virus is different from the outcomes when you've already got the virus. So they're comparing apples and pears. And then it really just concludes that without any data in this kind of summary report. So I wanted to go and actually see, well, let's have a look at the study. Let's see what they did, because if Pfizer and these guys can do, vaccine studies on 30,000 people, how come these guys have done 340,000, which is massive? Well, when you actually look into it, what you see is they used data from Biobank. Back in 2010, they tested people for their vitamin D levels and then measured their COVID outcomes in 2020. So that's 2010. I mean, guys, everyone knows vitamin D levels and vitamin levels change daily. 10 years ago, there is no way this study is statistically relevant or even accurate in any shape or form. I can't believe they've used this. These guys are scientists. They know this. So why have they done this? And I'm not sure. And, COVID-19 is a respiratory infection similar to influenza. So why don't we actually look at the data that's been done over years and decades, which show what vitamin D can do? And so the leading study in this space was actually published in 2017. And it was a randomized controlled trial, which showed that across 25 separate randomized controlled trials, over 11,000 patients, their conclusion was vitamin D supplementation was safe and it protected against acute respiratory tract infections overall. So how, when COVID-19 is that same thing, just in a slightly different form, are we concluding that there's not enough evidence and we shouldn't be taking vitamin D because it might not protect us, when it's cheap, affordable, very harmless, and has the potential to be so impactful on this COVID journey we're all going through? I'm frankly astounded, and I just wanted to share.